Hi everyone, today I'm going to be giving you guys my presentation on Meniere's disease. So what is Meniere's disease? Meniere's disease is categorized by a sensory neural hearing loss, having both the sensory component, which is within the hair cells, and the neural, which is within the nerve cells. And for Meniere's disease specifically, we're going to be looking at the sensory side of that sensory neural hearing loss. Meniere's is a progressive disease, meaning it is getting worse and more intense over time. There are recurrent episodes of vertigo, hearing loss, tinnitus, and oral fullness. It is unpredictable and it is also unknown. Some say it could even be hidden in a way. Since there are not many tests that can confirm this, you more so rule out other options, other pathologies, until you're left with Meniere's being the most probable cause. So some symptoms of Meniere's, we have vertigo, which is that spinning feeling. It starts and stops very suddenly, and it can last anywhere between 20 minutes and 12 hours. It can cause you to lose your balance. Some with vertigo from Meniere's disease would be more of a fall risk, and that can create worry and stress within a lot of clients. There's also categorized by hearing loss. So with this hearing loss, it would be fluctuating unilateral hearing loss early on. Over time, this can be long lasting and decline. It can also move to be bilateral, but for the start, it is usually a fluctuating unilateral hearing loss. They can also experience tinnitus. Tinnitus is that ringing, buzzing, roaring, even whistling or hissing that you can experience within your ear. For Meniere's, it is usually a buzzing or roaring type of tinnitus. And then lastly, oral fullness. Oral fullness is that feeling of fullness or pressure within your ear. Moving to some causes, although much is known about the symptoms side of Meniere's disease, there is not much known yet about the cause of Meniere's. There is speculation that it can be due to an over or extra production of endolymph, which is that fluid within your inner ear. But if that's the case, they're unsure what would cause that fluid to build up, that endolymph to build up. If we are going with endolymph being the cause, then some possible issues or reasons that would cause this buildup could be due to genetics, autoimmune disorders, viral infections, or even poor fluid drainage. That could be due to the ear shape or if there's a blockage of some kind. And since there is not one known cause, it could possibly be a combination of causes creating this Meniere's disease. Okay, moving to our diagram of the ear, we can see the semicircular canals and then also the otolith organs as the utricle and the saccule. And all of these structures in your inner ear contain fluid. That fluid, as we defined earlier, is called endolymph. And then they also include fine sensory hair cells. I've also seen them called vestibular hair cells, but they are synonymous. And those hair cells contain very tiny particles called otoconia. And the otoconia help you to keep your eyes focused on a target even when your head is in motion. They also help you to keep your balance. So if there is pressure buildup from that endolymph, from that fluid, those organs are not going to be functioning properly. I also wanted to make note of the eustachian tube placement. I think it is very nice within this diagram. All right, a normal inner ear versus an inner ear with Meniere's disease. So taking what we said before, that endolymph buildup can cause your inner ear organs and structures to malfunction. So if we were, let's think of a water balloon, our fluid in that balloon being the endolymph and our balloon being the endolymphatic sac. So when there's pressure increasing in that balloon, that endolymphatic sac fills, drainage is blocked and then the pressure will persist. Ultimately, it stops proper functioning of these structures. As we see here, normal endolymph and a normal endolymphatic sac. And then we have swelling, which will in turn distort the sound information that we're trying to perceive, a bulging endolymphatic sac, and overall really no room for any of the structures to have movement. Some risk factors associated with Meniere's, there are genetic factors. If someone in your family has also had this disease, you could be more susceptible to it. Females do have a higher risk than males, and the age range, the most common age range, is in between 40 and 60 years old. There are also autoimmune diseases or disorders that could put you at a higher probability to have Meniere's. Some things required to support the diagnosis. A physical examination by your primary physician has to note that there have been at least 2 vertigo attacks, again, ranging between that 20 minutes to 12 hours, starting and stopping very suddenly. And then complaints of hearing loss, tinnitus, and or oral fullness. I say and or because at the start of your symptoms with Meniere's disease, you will usually not have all of the symptoms that were listed in the previous slides. You will usually only have one, and since it is a progressive disease, more will come up over time. You will need to have hearing assessments such as audiometry conducted. So for the audiometry, they favor using inserts or circumoral phones to conduct the audiometry. You'll also use your bone oscillators. And then these audiograms are considered to be rising curves or reverse slopes. We will see why when we look at the audiogram later in this presentation. But typically you will see trouble being presented within the low frequencies. Sometimes it can be low and high, but that mid-range frequencies, those are usually and typically unaffected. Oftentimes, as I said previously, it will be unilateral sensorineural hearing loss. Now, as it progresses, it could possibly move to be a bilateral hearing loss, but at least to start, you're going to see a unilateral low frequency hearing loss. Other things can be conducted with that hearing assessment, such as speech audiometry, otoacoustic emission testing, or possibly electrocochleography. Another assessment that we can do is vestibular assessments. We would do an ENG, which is an electrostigmography, or we could, and VNG is very similar. We can do rotary chair testing or VEMP testing, all of which would really look at your inner ear based on your eye movement. All right, here we have our audiograms. So as we can see here, categorized by that low frequency, highest hearing loss. Highest hearing loss within those low frequencies, we're moving back up, rising and sloping back up, recovering almost around those mid-range frequencies. High frequencies over here are pretty much unaffected within this ear, and we do see a unilateral hearing loss. On this right side over here, this audiogram, I would think would be for a client who has had Meniere's disease for a little while, based on the fact that there is hearing loss within both ears. It is not symmetrical, but there are 2 different types of hearing losses going on here. But we can see low frequency loss, the highest being the low frequency loss, recovering around those mid ranges, and then having a drop around those high range frequencies. So for treatment and or management, there is no cure as of yet. There has been a lot of research and studies being conducted around Meniere's disease. And although there is no true cure for Meniere's, there are many treatments and medicines available that could help to lessen the effects. So for vertigo, there are different types of medicines for motion sickness and anti-nausea medication. Some people with vertigo do have the feeling that they are going to throw up, so those anti-nausea medications can help. There are also medicines that can reduce the extra fluid, that extra endolymph within your inner ear, which if that is decreased, that can increase your blood flow to the inner ear. Another thing, not so much treatment, more so management, your diet. If you were to limit your salt intake, that would help reduce the fluid retention, which could possibly help reduce the inner ear endolymph buildup. For rehabilitation, there is vestibular rehabilitation therapy, and we could also provide that client with hearing aids due to the hearing loss, the sensorineural hearing loss caused by Meniere's. And lastly, we have surgery. So there are 2 more common surgeries for Meniere's. The first one being an endolymphatic sac surgery, in which you remove part of the sac and in turn reduce fluid. Sometimes even when they're doing that surgery, they will insert some tubes to then help with drainage in the future. And then the other one is a labyrinthectomy, and that is when all structures are removed within the ear. In turn, you would lose all of the hearing in that ear. So say I had a labyrinthectomy on my right ear, they would go in and remove that whole labyrinth, all of those inner ear structures. I would be left with no hearing in this right ear, and I would then rely on my left ear, my better ear, since with Meniere, it's usually unilateral. That is shown in this photo right up here on this left side of the screen. We have that endolymphatic sac right here. So that's just showing the endolymphatic sac surgery, in which you would remove part of this endolymphatic sac, which would then help with your fluid, your endolymph buildup within that sac. And then at the bottom, we have the removal of the whole labyrinth, all of those inner ear structures. And then that would be taken out. Again, you would lose all of your hearing, so it is a little bit controversial, not as popular as the endolymphatic sac surgery, but both of those are options for Meniere's disease. That brings me to the end of my presentation. Thank you guys so much for watching, and I am ready to answer all of your questions. Thank you.